Hello, my name is Mary Williams, and I chose to view the video of handling temper tantrums with conscious discipline. As an educator, have you ever experienced a child who has had a temper tantrum? What did it look like? Were their face red? Were their arms wailing? Did they have screaming? Were they biting, kicking, or punching? Temper tantrums are normal for children up to age 3 years old, and they can occur when an urgent need is not met, or maybe they're tired, hungry, or even frustrated. In older children, they may have them for many different reasons. Maybe they have had an expectation that a parent or a caregiver has given into, and they've had one earlier in life, and they saw that it worked, so they chose to use that same behavior. Those unrealistic expectations of caregivers may happen when they're fatigued or tired in early children. Maybe you have taught a sibling, maybe an older or a younger sibling, and you've noticed that they have different temperaments. Some are easy tempered, others are hard to soothe. They're picky eaters, finicky sleepers. When they're upset, they're hard to calm down. Inconsistent routines or inappropriate discipline may affect how a child may have a temper tantrum. It also may affect the intensity that they have when they're having their temper tantrum. Different things work for different children. So, with conscious discipline, they help you recognize what the temper tantrum is. There are some helpful strategies that you can use with conscious discipline that will help you be able to work with the child and figure out what that child needs. Con- uh, Temper tantrums may have nonverbal communications, such as the screaming, the red faces, the holding their breath just so they can try to calm themselves down. What are they trying to say? Maybe they're trying to tell you that they're overwhelmed and they can't handle the situation that they're in, and they have no way of telling you how to express that. Parents or caregivers can teach a child how to act this way. Maybe they need to unhook themselves, take a deep breath, and calm themselves down. Maybe you should allow them to feel your energy. Offer empathy. Start from with the body, your facial expressions. Maybe you may have to pick up a child, or sometimes with conscious discipline, you have to leave the child alone. Some children can't be soothed the same way. So sometimes you may have to pick that child up, hold them, tell them to breathe, show them that they're safe, and then give them choices on what should they do. Maybe they didn't want to put the blocks away at this time. So you can give them a choice to say, well, maybe we can do this tomorrow if we can do all our work. And we can put them away right now, and maybe tomorrow we can finish up. So with conscious discipline, that creating that safety and that connectiveness will help you learn how to problem solve to help children who are having temper tantrums. Instead of the traditional shift from being compliant, wanting the child to behave or be obedient, giving them rules and consequences, not perfecting their behavior. Conscious discipline helps governs their behavior, giving them a willingness to want to solve their conflict instead of um, worrying about how to avoid or having rewards or punishments. So with conscious discipline and temper tantrums, you want to shift from the traditional way of doing things to the conscious discipline model, having them to think, having internal connectivity, building those healthy relationships, help them perceive their conflict differently. So let's shift from the traditional way we're behaving when a child is having a temper tantrum to the conscious discipline way we're creating and governing those behaviors to solve those conflicts.